Welcome to the second Ryan White Planning Council public hearing meeting for 2022. This public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view it and then download the documents from our website at rwpchouston.org. My name is Tony Crawford, and I am one of the council co-chairs of the Affected Community Committee of the Ryan White Planning Council. Also this evening is the chair of the Ryan White Planning Council, Crystal Starr, the co-chairs of the Priority and Allocations Committee, Bobby Cruz and Peta Gay Ledbetter, and Tori Williams, liaison to County Judge Lena Hidalgo. The focus of tonight's public hearing is recommended priority rankings for the foundations of the allocations through the fiscal year 2023, which will begin on March the 1st, 2023. But first, there'll be a presentation on the making your voice heard through the HIV community by Tori Williams. Is recommended priority rankings for the foundations of the allocations through the fiscal year 2023, which will begin on March the 1st, 2023. But first, there'll be a presentation on the making your voice heard through the HIV community by Tori Williams. Afterwards, Bobby and Peta, co-chairs of the Priority and Allocations Committee, will give an overview of their committee's processes, followed by their recommendations through the fiscal year 2023 priority rankings and funding allocations through the services funded by the Ryan White Part A Minority AIDS Initiative, which also is referred to as the MAI. Part B and the state services grants is also that what they'll be giving you their recommendations there. The allocations recommended include the level, increase and decrease in funding scenarios of each grant. Remember that everything discussed this evening will not affect the services delivered now, but will impact the services that will be delivered into the year of 2023 and 24. After the presentations, I will provide instructions on how you can make public comments regarding the information presented today. At this time, I would like to turn the meeting over to the chair of the Planning Council, Crystal Starr, who will describe the role of the Planning Council and its purpose of this public hearing.
Thank you, Tony, for the informative introduction. Good evening, everyone. I am Crystal Starr, chair of the Ryan White Planning Council. My pronouns are she, her, and hers. I am pleased to welcome you to our public hearing. I will briefly describe the history of the Planning Council, what it is that we do, and why we are here tonight. The Ryan White program is the largest federally funded program focused exclusively on providing HIV care for people who do not have sufficient health care coverage or financial resources for meeting the challenges of living with HIV. Ryan White fills the gap in care that are not covered by other sources. The Ryan White HIV/AIDS Treatment Extension Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting with each reauthorization to accommodate new and emerging needs, such as the increased emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with governmental entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve metropolitan areas and are awarded to the chief elected official primarily responsible for providing health care in the geographic area. And the Houston eligible metropolitan area. That person is County Judge Lynn Hidalgo. In 2021, Harris County received over $36 million to provide services for people with HIV throughout the 6-county area, which includes Harris, Fort Bend, Waller, Liberty, Chambers, and Montgomery counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part B and state services funds. Part B funds are awarded directly to the state of Texas and are used to provide care for people living with HIV in a 10-county area, which includes the 6 counties named previously, plus Austin, Colorado, Walker, and Warren counties. In fiscal year 2021, Ryan White Part A, Part B, and state service dollars total over $30 million. Again, Congress requires that most of these funds be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately half of the 30,000 people living with HIV in our area are using a Ryan White funded services. By law, the council is responsible for 1, determining the number of individuals in our area who are living with HIV. 2, assembling the needs of the HIV community. 3, establishing a comprehensive service plan. 4, setting service priorities and allocating funds. 5, assuring that there are sufficient services to meet the future needs of the changing epidemic. 6, assuring that appropriate services are available to meet the needs of the underserved women, infants, children, and youth. 7, ensuring access to services for those who have substance abuse treatment needs. And finally, accessing the administrative mechanism, which procures services and disperses funds. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in a hybrid format, which gives you the option of attending in person or virtually. The council meets on the second Thursday of every month at noon. For more information, call the Ryan White Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information is repeated again for you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. That means that all resources for individuals must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid, or Medicare benefits before they are eligible to have Ryan White monies paid for primary medical care. There are also important income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means that an individual with a yearly income of $40,770 or less will be eligible for assistance provided all other avenues of coverage have been exhausted. The same guidelines applies to a single parent with one child would be $54,930 or less. The service category rankings and allocations that we reviewed this evening include services funded by Ryan White Part A, Minority AIDS Initiative, referred to as MAI, Part B, and the Texas Department of State Health Services. Examples of some of these services which Ryan White program funds are allowed to provide include outpatient, ambulatory services, primary medical care, medication, oral health care, mental health services, and assistance to pay for health insurance premium copays and deductibles. The purpose of this public hearing is to inform the community about the recommended service priorities and funding allocations for fiscal year 2023. In order to get feedback from consumers of Ryan White funded services and others as to how the recommended changes will affect their ability to receive medical care and supportive services. Community input is not only necessary, it is vital to all of the planning council processes and is encouraged at every level. At this time, I would like to introduce to you our next speaker, Tori Williams, Director of the Office of Support and Liaison for County Judge Lynn Hidalgo to the Ryan White Program. She will present information about you can make your voice heard in the HIV community.
Thank you, Crystal. As you just heard, the Ryan White Planning Council is responsible for planning the delivery of HIV services in a 10-county area, specifically in the areas of outpatient medical care and medically related support services. In 2021, the council allocated federal and state funds in the amount of $30 million, which is currently being used to provide medical care, medication, and other services for approximately 15,000 individuals of the 30,000 people living with HIV in the greater Houston area. The staff of the Office of Support assists the Planning Council so that Ryan White volunteers can design HIV services and attach funding to these services. Our staff collects all kinds of information that helps council members make decisions. Some of the data that the council reviews regularly is the number of people who use Ryan White funded services, the average cost of the service per client, and the amount of money that agencies spend delivering a particular service. One of the most important things that the council needs to know is the client's experience. Do clients know what services are available to them? Is the service easy to access? If not, why not? It is critical that people who use Ryan White funded services share their experience with us. Over 50% of the people serving on the Ryan White Planning Council are people living with HIV. But we need to know what your experience has been, both good and bad. And we are always looking for additional volunteers to help us make decisions and become leaders in the community. So this program is about getting involved and having your voice heard. Let's start with a graphic that we put together called Ryan's House. And let's start on the right-hand side of the chart with prevention. The Houston Prevention Community Planning Group, or CPG, is made up of approximately 35 volunteers who are selected to ensure that scientific evidence and community values are incorporated into Houston Health Department HIV-related work products. An application is required. Also, there are consumer advisory boards, or CABs. Due to the COVID pandemic, these groups have not met recently, but soon these consumer advisory boards and task forces will start meeting. And again, Ivan Prater may be able to tell you when they're meeting and where they're meeting. Another way to get involved is to be a patient mentor. You can apply to be a patient mentor at Thomas Street Health Center by contacting the manager of volunteer resources at 713-873-4873. Another way in which you could get involved is through the Ryan White Planning Council and CPG co-sponsored program called Project LEAP. Project LEAP is a free 17-week class that provides a basic understanding of Houston's HIV prevention and care systems and how consumers and others can interface with local planning bodies like the CPG and the Planning Council. After our graduation, it is hoped that the graduates from Project LEAP will apply to join both the CPG and the Planning Council. The way to find out about this unique training program that is nationally recognized and available only in Houston is to go visit our website and apply at rwpchouston.org. We're also very pleased to announce that 2 weeks ago, we started Proyecto Vida, which is the Spanish version of Project LEAP, and which again, our hope is that folks who graduate from Proyecto Vida will want to serve on our planning bodies. To apply, one can go to our website, which again is wpchouston.org. The next item on the Ryan's House chart is called the Ryan White Planning Council. And as you know, approximately 40 community volunteers are appointed by the county judge and tasked with designing and attaching funds to HIV services to help individuals living with HIV in the 10-county area. If you wish to apply to be a member of the Planning Council, call us at 832-927-7926 or visit our website, which you see on the screen, which is rwpchouston.org. The Ryan White Planning Council also has a number of committees and work groups. So if you'd like to start in a way that's less time consuming than if you were to apply to be a council member, you might want to join one of our committees or one of our work groups. Annually in February, the Ryan White Planning Council releases a calendar of council, committee, and work group meetings, as well as when we have our public hearings. These meetings are open to anyone who wishes to observe or make a public comment. To confirm when our council, committees, and work groups are meeting, feel free to call us at 832-927-7926. Or if you wish to receive that annual calendar or monthly calendars, go to our website, rwpchouston.org, for more information. And the last thing that you'll see on Ryan's House is Ending the Epidemic, which is a 5-year initiative that focuses on 4 key strategies to end the HIV epidemic in America. Those strategies are diagnose, treat, prevent, and respond. The Houston HIV community is hosting meetings between now and September of 2022 to develop a 5th pillar, which will focus on the quality of life for all people living with HIV. There is no group in the country that is doing this, so it is groundbreaking and very interesting work. So I hope that you will begin to join us for some of these meetings. To receive notices and participate, sign up on our website at rwpchouston.org. There are many ways to have your voice heard. By participating in training programs like Project LEAP, you can learn new skills while making new friends and creating a network of helpful contacts. While you are attending classes, you can also attend meetings and share your ideas and personal experiences, which will help us create services that are more effective and user-friendly. I hope that you will browse our website for interesting ways in which you can get involved, because we need your voice in this process. And now, let me introduce 2 Ryan White Council members, Bobby Cruz and Peter Gay Ledbetter, who are the co-chairs of the Priority and Allocations Committee and who will explain the committee's processes and present the proposed service category, priority rankings, and funding allocations for fiscal year 2023.
Thank you for the valuable information, Tori. It may well encourage many people to use their voices to strengthen and enrich the planning process for HIV services in our community. Speaking of the planning process for HIV services, each year in April and May, the Quality Improvement Committee of the Ryan White Planning Council considers many facts when reviewing the definition of each Ryan White funded service category. When the Quality Improvement Committee changes what is offered through a service, the changes are based upon information such as the documented needs of various populations living with HIV in the greater Houston area, the history of service usage, epidemiological trends, and the availability of alternative resources, including both Ryan White and non-Ryan White funding. Once the service category definitions have been approved, it is time for the Priority and Allocations Committee to prioritize the individual service categories and allocate monies to each one. Tonight, we are going to talk about the work of the Priority and Allocations Committee. The mechanism for awarding Ryan White funds changed in 2014, and we are now seeing southern parts of the country, such as the Houston eligible metropolitan area, receive higher grant awards, while areas like San Francisco and New York are experiencing significant decreases in their award amounts. That is because the South is where new diagnoses are on the increase. Starting in 2015, the Houston area received an increase every year except 2, where we got a small decrease. This is good news for the Houston area, but some would say that we have been underfunded for many years, and we now have the opportunity to catch up with a growing number of people who need our services. In recent years, a significant factor in determining the allocation of funds to individual service categories has been the availability of private health insurance offered through the Affordable Care Act. There are currently over 5,600 clients registered in the Ryan White system that are enrolled in either public or private health insurance. The anticipated result is that there will be a reduction in the use of Ryan White funded medical services and an increase in the number of clients needing help through the Ryan White Health Insurance Assistance Program. Similarly, the COVID-19 pandemic has increased the rate of unemployment, which may prompt an increase in the number of individuals seeking Ryan White funded medical services due to a loss of private health insurance coverage. Another significant factor is extended application processing time and changes in eligibility requirements of the Texas HIV Medication Program, commonly referred as the AIDS Drug Assistance Program, or ADAP. As you know, access to medications is vitally important, and we are allowed to use local funds to fill this gap. In addition to our Ryan White grant, Houston also receives Minority AIDS Initiative, or MAI funds. The goal of the Minority AIDS Initiative is to address racial and ethnic disparities in HIV-related health outcomes and expand community-based capacity to serve people of color living with HIV. The proposed service priority rankings and funding allocations to be presented tonight are for fiscal year 2023, which begins on March 1st, 2023, and includes the following funding streams: Ryan White Part A, MAI, Part B, and state services. The proposed service priority rankings for 2023 are based primarily on use and need as documented in the 2020 Houston HIV Care Services Needs Assessment. Allocations would typically be based on expenditures from the previous year, but due to the COVID-19 pandemic, 2020 and 2021 were unusual years, and services were not utilized as they would be in a normal year. Therefore, the fiscal year 2023 allocations are based on allocations for fiscal year 2021 with a few exceptions. Currently, there are approximately 15,000 people living with HIV in the Houston area who rely on Ryan White funds to pay for some or all of their HIV-related medical care. Please note that the 2020 Needs Assessment Report that is used to determine service priorities was completed prior to the outbreak of the coronavirus and is scheduled to be updated again in 2023. I will now present the service priorities and the first of 3 different funding scenarios. The level funding scenario, which assumes we will receive the same amount of funding in 2023 as we did this year. Detailed information about all of the funding scenarios is included in the information packet, which is available on our website. The first 10 service categories are defined by the federal government as core medical services, and the legislation requires that we spend at least 75% of our grant funds on direct medical care for Ryan White clients. The remaining 25% can be spent on support services, such as transportation to medical appointments, service linkage, and more. The Houston area typically spends 80% of our Ryan White funds on core medical services for Ryan White clients. The recommended allocations for 2023 are the same as the fiscal year 2022 final allocations, unless otherwise noted. The first is priority number 1, ambulatory outpatient medical care. The proposed allocation for Part A is $10,965,788 plus $2,107,818 in Minority AIDS Initiative funds for a total allocation of $13,073,606. Priority number 2 is medical case management. The proposed allocation for Part A is $1,880,000 even, plus $320,100 in Minority AIDS Initiative funds for a total allocation of $2,200,100. This is an increase of $150,000 to accommodate an increase in the average allocation per full-time employee in order to encourage higher case management salaries and address the high rate of staff turnover. Priority number 3, local pharmacy assistance program. The proposed allocations for Part A is $2,067,104. This is an increase of $56,744 to address ADAP issues. Priority number 4, oral health. The proposed allocation for Part A is $166,404, and the proposed allocation for Part B is $2,218,878 for a total allocation of $2,385,282. Priority number 5, health insurance premium and cost sharing assistance program. The proposed allocation for Part A is $1,583,137. For Part B, it is $1,028,433, and for state services, it is $864,506 for a total allocation of $3,476,076. Priority number 6, mental health services. The proposed allocation for state services is $300,000. Priority number 7, medical nutritional therapy. The proposed allocation for Part A is $341,395. Priority number 8, home and community-based health services. The proposed allocation for Part B is $113,315. Priority number 9, substance abuse treatment. The proposed allocation for Part A is $45,677. And lastly, priority number 10, hospice services. The proposed allocation for state services is $259,832. I will now turn the floor over to my co-chair, PETA, who will present the recommended allocations for the non-core services, as well as the increase and decrease funding scenarios for fiscal year 2023.
Thank you for the introduction, Bobby. The remaining service categories are defined by the federal government as non-core or supportive services. Starting with priority number 11, referral for healthcare and support services. The proposed allocation for state services is $175,000 to be used to provide HIV education and discharge planning in the Harris County Jail. Priority number 12, non-medical case management. The proposed allocation for Part A is $1,267,002. And the proposed allocation for state services is $350,000 for a total allocation of $1,617,002. Priority 13, transportation. The proposed allocation for Part A is $424,911. This includes bus passes, van service, and gas vouchers for those living in rural areas. Priority number 14, emergency financial assistance. The proposed Part A allocation for the pharmacy assistance subcategory is $1,545,439, which is an increase of $240,000 to address ADAP issues. The proposed Part A allocation for the other subcategory, which provides one-time, short-term, emergency, food, telephone, and utilities, is $100,000. This is a decrease of $140,000 due to underspending in fiscal year 2021. Priority number 15, linguistic services. The proposed allocation for state services is $68,000. Priority number 16, outreach services. Primary care retention and care. The proposed allocation for Part A is $420,000. The fiscal year 2023 service dollar allocations total $28,612,739 under this level funding scenario. Because the exact amount of Ryan White funds we will receive in 2023 is not yet known, we also have a decrease funding scenario and an increase funding scenario, each of which is designed to best meet the needs of the community under these different circumstances. These funding scenarios are also included in the information packet on our website. If the Minority AIDS Initiative were to get a decrease in funding next year, all primary care subcategories would be decreased by the same percentage. This applies to the total amount of MAI service dollars available. If the Minority AIDS Initiative were to get an increase in funding next year, all primary care subcategories would be increased by the same percentage. This applies to the total amount of MAI service dollars available. If Part A were to get a decrease in funding next year, all service categories except subcategories 1G, which is pediatric primary care, 2H, pediatric medical case management, 2I, medical case management for veterans, 2J, medical case management for youth, 10, outpatient substance abuse treatment, 13A, service linkage for youth, and 13B, service linkage for newly diagnosed and not in care, would be decreased by the same percentage. This applies to the total amount of Part A service dollars available. If Part A were to get an increase in funding next year, we'll allocate the first $500,000 to ambulatory/outpatient primary medical care proportionately across all subcategories and allocate the next $200,000 to the Health Insurance Assistance Program. Any remaining increase in funds will be allocated by the Ryan White Planning Council. If Part B and state services were to get a decrease in funding next year, a decrease in funds of any amount will be allocated by the Ryan White Planning Council after the notice of grant award is received. If Part B and state services were to get an increase in funding next year, allocate the first $200,000 to oral health untargeted, divided evenly between the general oral health and prosthodontic subcategories. Allocate the next $200,000 to the Health Insurance Assistance Program. Any remaining increase in funds will be allocated by the Ryan White Planning Council after the notice of grant award is received. Many volunteer hours were devoted to this challenging work. We generously thank all the community members who worked so hard to fine-tune each service category, prioritize the services, and allocate the funds. Public input is strongly encouraged and is an integral part of this process. Depending on the comments made regarding the information presented at this hearing, the Priority and Allocations Committee may meet on Wednesday, June 29th, to discuss whether the comments provide enough data to justify changing the recommended priorities or allocations. I will now turn the floor back over to Tony, who will explain the process for submitting public comments regarding the information presented at tonight's public hearing.
Thank you, Peta and Bobby. The very special thanks to the Priority and Allocations Committee for their hard work this year. After hearing information presented this evening, you may want to give a public comment to the Planning Council. The Planning Council falls under the Texas Open Meeting Act, and its processes are open to the public at all levels. We strongly encourage participations through all the members of the community, and we take public comments and input very seriously. There are several options for you to provide public comment to the Planning Council, and if you're not required to give your name or your HIV status to do so. You can call in your comments to 832-927-7926 by phone. You can fax your comments to 713-572-3740. You can also email your comments to the feedback rwpc@hctx.net. Or you can send your comments through the Facebook page as RWPC Houston. Comments received by our council before the noon Tuesday and June 28th are forwarded to the Priority and Allocations Committee for review and considerations. If significant public comments related to service privileges of the allocations are received, the Priority and Allocations Committee will meet via Zoom on the 29th to review the comments and consider revising the recommendations. On the 7th of July and July 14th, the steering committee and the council will review and vote on the fiscal year 2023 service priority and funding applications. You are welcome to attend any of these virtual meetings. Check our website and calendar for the instructions on how to participate by Zoom, or call the office at 832-927-7926. This concludes the final Ryan White Planning Committee for hearing for 2022. And I would like to thank everyone who viewed the program and participating in this important process. As stated earlier, the funding recommendations presented tonight will not affect any of the services that are delivered now, but will come into effect in the service delivered approximately 10 months from now, which is the year 2023. The Ryan White Planning Committee meets on the second Thursday of every month by noon in a hybrid format, which gives you the option of attending the meeting virtually or in person. Please check the calendar on the website of rwpchouston.org for the location for the meeting of the Zoom link. The staff is working remotely, so please do not come to the office without calling or to make sure someone is there if we're open. Time is running out to apply for Project LEAP 2022. The free training program, which looks at HIV prevention and care systems in the greater Houston area. Please visit our website at rwpchouston.org to download the application and submit your application online. Applications are due by July the 8th. This is a wonderful learning experience, and I encourage everyone interested in HIV services to apply. If you would like to send comments to the council, request additional information, or learn about our education classes such as Project LEAP, you may also do so by calling the council support office at 832-927-7926, by faxing to the 713-572-3740, or you can send an email through the website at rwpchouston.org. On behalf of the Ryan White Planning Council, we thank you again for participating and have a good evening.